Thank you, and welcome to the 25th Annual PPMD Conference. It's kind of amazing to be standing up here and talking about Conference 25. We've been around a while, we've done some things together, and so I'm going to just welcome you to this session and then the bigger session a little bit later. So Conference 25. So for those of you who are new to Duchenne muscular dystrophy, I think it probably feels like you've gotten a free pass to something pretty hard. You didn't have much choice in that, and many of you came new to this conference this year and probably struggling with this free pass that you didn't really want. I think some of you are probably thinking, is there a get out of jail free card? And you'd like to use that probably today and get out of this situation because Duchenne's hard and complicated. But I think there's value here, and I'd like to talk to you about it. I was like you many years ago. So that little girl with those three brothers is me, and we'll say several years back. At the time that I was with those three brothers, I didn't know I was a genetic carrier of Duchenne muscular dystrophy. You can see those three little boys around me were all healthy, and they all lived to be adults, and they didn't have any muscle disease at all. So I was completely unknown as a carrier. Later, the picture up front is my husband and I. Tom was family practice in Middletown, Ohio, and we had moved to Middletown, Ohio, and this was one of our first years in our house in Middletown, and then we had a little girl, Jenny, by that time, and then the rest came along, Michelle, Chris, and Patrick. And I didn't know even then, at this particular time, that I was a genetic carrier of Duchenne. That happened when Chris and Pat were 4 and 6 years old. I wondered about their weakness, my husband wondered about their weakness, and on a single day in June, a doctor mentioned the word Duchenne muscular dystrophy. So then what happens? How do you balance life after this diagnosis? What do you do? Who do you talk to? What do you say? What do you search for when people are saying words about Duchenne muscular dystrophy that you've never heard? Your first question is, where do you go? What do you do? And I played if-then. If this happens, then that happens. If I get this, then the boys get that way. And how can we make them live and thrive and have long lives? So balancing this diagnosis, and I think probably all of you have experienced this imbalance that happens. For me, it was 24/7 looking at research and reading every single paper I could find. At the time, there was no social media, so that was probably a gift for me. That might have thrown my entire family over the edge. But now you have social media. But back then, you had to order these publications. You had to wait 2 weeks until they arrived. They were in print. And then spending late nights reading about what was known and what was unknown. And way back then, the unknown parts were significantly greater than the known parts. And so trying to balance your life now about what do you do when? Do you spend 24 hours a day on social media? Do you believe all that you hear on social media? Is Mr. Google the place for medical information? And sometimes it's hard to even think about what are the questions to ask. Because sometimes we see loud voices and they have all the answers or none of the answers, and you don't know what's the question to get out answers to exactly what you think about. So, you're bombarded with information. You're going to be bombarded with information for the next couple days. You're going to hear words, if they're new to you, you're going to hear mutations and frame shifts and deletions and duplications, and you're going to hear dystrophinopathy and all of these words that you can think about, oh my gosh, I don't even know if I understand them. But the truth is that you'll hear them over and over, and you'll become comfortable with them, and you'll know what they are, and you'll be able to talk about them, and it'll settle in. But if you get bombarded, don't feel bad about saying I'm slipping out to the pool or the bar. There's that. I don't think it's open yet, but there's always that. But you have to balance this life. And for now, and to start off, we're just going to think about where we are in this ecosystem. So what is the patient? What is the family? What's the role of the patient and family? Long ago, when I was in my career in nursing, we were a pretty paternalistic society. The docs and the nurses felt like they were pretty smart, the smartest of all. We used to run, since I ran the intensive care unit, I used to run around in a surgical gown and think I knew everything, right? And it's only when you hear the patient voice that you find you don't know anything until you listen. And I listened long ago in the ICU about what patients' needs are. And when my boys were diagnosed, I met a paternalistic society and thought, we need to turn you around and we need to listen to the patients. And so that's why you're here, this collective voice, because we're in an ecosystem with bench scientists, with companies, with academic centers, with clinicians, with each other, with payers. So our goal collectively is to advance therapies, get them approved, have access to them, and get them reimbursed. Our single and only goal is to make sure that these young men and some women have access to therapies and that no family is bankrupted in the middle of that. So these are the first steps. This is the first opener for our meeting. So take care of today. Take care of you today. Do yoga in the morning. There was a small class in yoga today, and I wasn't there, but I heard it was a terrific class, and I'm very biased because my daughter's teaching it. So there's that. And Jason is with her, and he's terrific as well, so I recommend you take yoga in the morning, just to take a breath, stretch a little bit, clean up your mind, and think about today. You're going to think about this minute. If these are overwhelming sessions, take a break. Go to your room, the pool, the bar, wherever you feel comfortable, even just outside, even though it's terribly humid, and I worry about alligators, but there's that. Just take a break. In these next weeks, the most important thing for you with a new diagnosis is where's the care for your son? What does that look like? What are the things you should be thinking about in terms of care? What is the most and greatest priority to make sure your son is in the arms of a good interdisciplinary clinic? And you might know that PPMD started a Certified Duchenne Care Center program. We have 25 clinics across this country that are Certified Duchenne Care Centers that provide interdisciplinary care. And take care of yourself. As a mom, I thought that I should be home 24/7. Denise will be speaking a little bit later and tell you that that's a little bit of a lie because I tried to escape. Because it's hard. It's hard to be a mom. It's hard to be a parent. It's hard to be a father. It's hard to watch. It's hard to be a grandparent and watch a family that you can't change, that you can't interrupt and give your opinion and tell them how they should live their lives. And I think if Michelle spoke up today, she'd say she's an adult now, and I'd like to order her life as well, but she doesn't usually ask me to do that. So again, it's hard to be a parent or a grandparent and watch this and not want to orchestrate it as far as possible. But you need a break. You need to take yoga. You need to get time for yourself so that you can think clearly about the decisions you'll have to make. So there's yoga. It can even be partners yoga. That's not so bad either. All right, you are by definition in this position where you are your son's best advocate. You don't have a choice. And the reason you don't have a choice is because I am certain that when you say the word Duchenne muscular dystrophy out loud, you might hear, I have never heard of that. Or you might hear, my uncle's sister has MS, and that's the same, right? It isn't, no. So it's frustrating, right? So you become the advocate and the educator. When you take your sons to school, the teachers may say the same thing. They may not know how to understand what your son's capabilities are, what the limitations are, what he should do or could do. Your son may be on steroids, which may affect his behaviors, and so trying to separate those behaviors and manage those behaviors in a way that's productive at school and at home, you're going to have to do that too. Your voice is important in your community and your neighbors and your extended family who all want to know what to do and how to help or not. And so you find yourself explaining what's going on and why. So you don't have a choice. You're an advocate. Your voice matters. It will change the world for you, and it will change our collective world together. Here's what you're going to find here. I'm sure you will meet other people, other families. You will find support. The PPMD team is always here to support. If you ask them about me, I think that they should be working 24 hours a day. I think they do most of the time. So you'll find support here from our team, but you'll also find support from each other. You'll meet families that you'll become close friends with and that you don't have to explain anything to. So that's good. You'll meet also clinicians here, and not in the patient in the patient-family relationship, just friends to talk about what's important and what's important to you. You're going to find love here. You're going to find people who know and care and want the best for you and your family. So that's the beauty of advocacy, and that's the other side of you being an advocate by definition. So a lot has happened. This is way back when, Eric Hoffman and I, and the first center that we developed, which was the DMDRC, or Duchenne Muscular Dystrophy Research Center, the first DMDRC in the world, that was organized way back 25 years ago and funded by PPMD. It was our first investment. And that's when I was young and Eric Hoffman is young, and we've all come together 25 years into the future. So hope lives here. This is a pipeline that you see of trials. There are 46 companies and growing that are focused on this disease. We have 21 companies here this year at this meeting that you will interact with and hear from. We have many more companies in the preclinical space, which means just before they go into clinical trials. So that's very exciting. We have improvements in care. The second iteration of the care considerations or standards of care was published in 2018. We still have work to do on standards of care to improve those existing standards, and we will. And you see a disease, the little spider web, a well-characterized disease that we understand, Duchenne muscular dystrophy, pretty well. We still have work to do there. We have to understand the differences of a child and his brother with the same mutation who progress differently. We still have work to do and understand, is there a protein signature here where we could measure it easily? We have work to do on outcome measures so that we can better understand what benefit looks like in these kids and measure it so that we get approvals. But hope lives here. We're here now, and we can do this together. So this is your story, right? It's a story you maybe didn't anticipate with the word Duchenne muscular dystrophy in it, but it's a story, and it's going to be a good story. I'm glad you're here, and we're going to start off with what happens and what should happen today. So our first speaker is Christina Trout.
So I'm Christina Trout. I'm the nurse from the neuromuscular program at the University of Iowa, and I'm happy to talk with you. And I see some familiar faces that I've met in past conferences and some new faces as well. So it's nice to be here and talk with you about getting a plan and setting up your care team. This is, as we've all talked about and learned about, it's a complex disorder, and it's also a very complex healthcare system that we have to function in. And I have a little cartoon at the top here that's depicting families as I often see them when I first meet them. And not everybody's on the same page or having the same plan in mind when they first enter the world of Duchenne muscular dystrophy. As Pat already described, I have some of my families where one spouse is looking on the internet and finding the perfect clinical trial for their son with Duchenne muscular dystrophy, and the other spouse is really more reflective and sitting back and thinking, how did I get here? How can I start with a plan when I really don't even know where I am? So you may not be at the same starting point when you begin to plan for the future dealing with Duchenne muscular dystrophy. And we know that you may have other children as well, so it's important to think about the rest of the family and starting with your plan about what's important to you, your son, and your family as a whole. And sometimes that's an honest conversation amongst you as a family, and then once you've decided we're going to take this step forward, stick with your plan and move forward and adjust as you need to. The first step is deciding what is the goal, and most of the time when I talk with families, they say our goal is to do the right thing, the best thing for our son. So it's really a balancing act, as Pat said, to balance what's important for your son as well as all the members of the family. And once you're taking those first steps, which if you're here in the conference or if you're watching the live stream, you're really taking the first step, which is gathering information and putting that information into a plan that meets with the care team. And a team is individuals coming together to achieve a common goal. And so I think as you meet your healthcare team, you will learn that you all have the same common goal, which is doing the right thing for your son. You will learn that you have actually a pretty large team, and that there are key players that will come in and out of your, thank you. You'll have a lot of members on your team, but there will be some key players that come in and out of your healthcare system. And from time to time, those are going to be coaches. They're going to give you information, they'll guide you, they'll help you to understand what decisions need to be made, but ultimately, as a family, it will be up to you to take action on those plans and follow through with the coaching and the teaching that you've had. You'll also discover you have a lot of cheerleaders. Some of those cheerleaders are in the room here, and you'll learn that you have cheerleaders in your community, your extended family. You'll find people that you didn't even know were close to you but want to help you and support you along the way. You'll also be introduced to officials or rule keepers. I typically think of the insurance companies as having a lot of rules, but your team members are going to know those rules and help to facilitate you getting through the system and getting the things that you need for your son. Those might be medications that require prior authorizations, or they might need letters of medical necessity to get equipment along the way. You'll also learn their sponsors, and throughout this conference especially, you'll learn who's funding your healthcare, and thinking about the Centers for Disease Control, how they funded the MD Care Act, and how they put together care considerations for best care practices, and the drug companies, of course, for funding research. The action is starting in your hometown. You've probably worked with a primary care provider who identified signs and symptoms that led you to a specific diagnosis. Now that you know that you have Duchenne muscular dystrophy for your family, you'll work with your community, and for the boys with muscular dystrophy, that's typically in the school. Then you may discover that your care team takes you away from your hometown community and that you're traveling at least across town if you live in a big city, or maybe a longer distance if you have to travel to a neuromuscular center. The picture there is my neuromuscular center at the University of Iowa, and it can be big and complex and seem overwhelming, but once you are established with your care team, they will help guide you through the big system. The care for individuals with Duchenne muscular dystrophy is considered comprehensive and multidisciplinary. That means that they're going to consider all of the body systems and how they work together. And over time, this will change, and you'll meet new providers as you have more symptoms and need more management. These individuals are organized and they should be working together. The picture here shows that the individual with Duchenne is surrounded by their family and then within their community, and that once you enter the specialty care for Duchenne muscular dystrophy, you want knowledgeable care providers all around you so that you're not having to recreate a care system for your child. This care system of specialists then should communicate with your home team, which is your primary care office. So your first two teams include your primary care office and providers, as well as the neuromuscular team. The picture here is one of our teams. We happen to do traveling clinics so that we make the Duchenne muscular dystrophy care available in their communities. Your primary care needs to continue throughout your lifespan. Oftentimes people stop having well-child checks once they're through the elementary school years, but we would encourage you to maintain contact with your primary care office at least once per year, if not twice a year. It's important to have continuity of care over time. They need to know your child or you at your baseline in order to make assessments when you come in with an illness or an injury. They can also help to access your community resources for psychosocial care and make sure that your whole family is coping and adjusting, and that you have access to the care that you need there in your community. The primary care office will also make sure that your immunizations are up to date. That can be particularly important as you start on corticosteroids, and making sure that you and your family members have annual flu shots so that you can prevent a worsening episode of the flu should someone contract it. As Pat already mentioned, once you are ready to establish care that's specific to Duchenne muscular dystrophy, there are certified Duchenne care centers across the United States. We recognize that not every big city in the United States has access to these clinics. There are other neuromuscular centers. If you feel your family cannot financially or physically make these distances, then we would want you to talk with the neuromuscular centers that are in your community to ask them, how do they take care of boys with Duchenne muscular dystrophy? Do they provide coordinated care? Do they have access to the specialists that are needed? Your neuromuscular care to start with is going to include a neuromuscular specialist, typically a care coordinator, nurse, and social worker, a physical therapist, genetic counselors, and possibly a neuropsychologist. The neuromuscular specialist is typically a neurologist, but there are some other types of doctors that provide the neuromuscular care. They need to be knowledgeable about Duchenne muscular dystrophy. If you're not at one of the certified Duchenne care centers, then you should be asking how many boys do they take care of with Duchenne muscular dystrophy and what is their experience? How are they keeping active related to the information relevant for Duchenne muscular dystrophy, since that's actively changing? The neuromuscular specialist will likely be presenting options for treatment. Those first treatments include discussions about corticosteroids and when best to start them and what regimen is appropriate for your age and your personal body, your child's body. And they might also be talking about mutation-specific therapies and helping for you to understand why some therapies are appropriate for your son but not appropriate for others, or vice versa. If you are at a center that is well-versed in clinical trials, they would also be pointing you in the right direction for clinical trials that are age-appropriate and where your child meets the specific criteria, and helping you to learn what options might look like as you make these decisions. Ultimately, as a family, it's up to you to decide what pathway is best for you and your family. And the neuromuscular specialist will follow you over time. Typically, that means about every 6 months, sometimes more frequently, like every 3 months. And then a clinical trial is where you're followed very closely in a very tight, regimented schedule. I will comment that if you're participating in a clinical trial, that does not necessarily mean that you are getting access to good health care. Those are separate entities. A clinical trial is where they're gathering data about you or your child's health to complete a data set. The clinical care is where the doctor is assessing you and thinking about your specific health care needs and making recommendations specific to your child's health care. Again, the neuromuscular specialist then communicates the information that's gathered and the monitoring and communicates back to your primary health care. The coordination of care is often involves a nurse, and that's my role. I'm a point of contact for questions. Some of the information that you hear on in the appointments, as well as what you read on the internet, is complex, and you might need someone to clarify and simplify the information, as well as identify and think about what new symptoms that your child is having and how does that relate to Duchenne muscular dystrophy, or if this is just a normal childhood symptom that they might be experiencing. Typically, the nurses and care coordinators are available between visits by either email, electronic records, or by phone call. And they can then decide whether or not it is a face-to-face appointment might be helpful to you. The role of the nurse, as well as some of the other care coordinators on the team, can help you to advocate for equipment that you might need, or to get you through the prior authorization process if you need medications that are relevant and prescribed. The social worker is another key person for coordinating care and another point of contact for questions. Typically, the social worker is assessing for how you're coping and adjusting to new changes. They would also be the person who best knows the financial resources, like how to access disability benefits and how to access state Medicaid programs that have waivers to help fund your care. The social worker will also determine who needs to have an exchange of information with your healthcare team, perhaps with your school or with the other payers, or if you're getting grants or other financial assistance, they can facilitate some of that paperwork. The physical therapist, of which Claudia is going to go into that information, but the physical therapist is the person who does the assessments of strength and range of motion. Again, I commented on that some of these things, such as a time test where your child is timed getting from the floor up to a standing position or going upstairs, or a very detailed motor assessment. Sometimes that information is collected for a clinical trial. Other times it's collected for the purposes of monitoring your child's response to a therapy that's been prescribed. The physical therapist will also then instruct on stretching and orthotics and recommendations for activity and exercise. The physical therapist can also be your advocate in the school system, helping your PE teachers and teachers to understand how to best maximize their energy throughout the school day and to make recommendations for safety so that they're not placed in a situation where they might injure themselves. As changes in health go over time, there may need to be equipment or other things to help with activities of daily living, and the physical therapist and the occupational therapist might be enlisted as well. Genetic counseling, the term itself, counseling, suggests that someone's talking about your emotional well-being, and a genetic counselor may address your emotional well-being, but really the process of genetic counseling has to do with giving you information specific to the genetics, using genetic concepts and terminology. So they can be the ones to help you better understand your mutations in relations to treatments that might be considered or clinical trials. And they can help explain terms like exons or genotypes and phenotypes, as those are terms that would not be common in everyday life until now. The genetic counselor will also look at your family history and determine whether or not there are other individuals in your family who would benefit from genetic counseling and/or testing. They review X-linked inheritance, and although genetic counseling is typically done at the time of diagnosis, it's relevant to have genetic counseling again later in life, particularly in the teen years. In the teen years, we want to make sure that young women in the family have access to information about not only reproduction, but the relevance of being a carrier to their own health. And I'm sure that you'll hear some of those talks later throughout the conference about the importance of everyone in the family knowing who's a carrier and what specific mutation that you might have. The genetic counselor will also talk about reproductive options and facilitate testing. There's a program called Duchenne, Decode Duchenne, so that if you've had difficulties accessing genetic testing due to financial barriers, that program can be helpful. If you have not had access to a genetic counselor in your clinic, you might be able to access the genetic counselors through the Duchenne registry. They have genetic counselors that staff that registry that can answer questions and are very knowledgeable about Duchenne muscular dystrophy in particular. I've listed the website here, but I understand that the Duchenne registry is going to have some updates and have a phone app over the next couple of months. So if you're trying to update your registration, you may find that there's some technical difficulties until that's worked out. It's important for you to join the registry so that the information about your child and your family is communicated to the greater Duchenne community. The researchers and industry partners who are looking for males with Duchenne muscular dystrophy to have in their clinical trials want to know where you're located and how many boys in the right age category and the right physical attributes would be involved in their studies. This is also a way for you to get research information by being a part of that registry. As you continue along the journey of your healthcare and adding to your healthcare team, you may have a neuropsychologist, and you're going to hear some talks about neurobehavioral components of Duchenne muscular dystrophy. And then you will also start to have care providers through the cardiology team, as your heart is a muscle and needs to be monitored over time, either with an echocardiogram or a cardiac MRI and EKG. You will have a pulmonologist who will look at your strength of breathing and the ability to cough forcefully. You'll have an endocrinologist who deals with bone health and growth. So you're going to have a lot of healthcare providers that are added to your team over time. It's important for you to also be connected and plugged into the Duchenne community. Just by being here or participating in the live stream, it shows that you have an interest in gathering more information. As Pat has also commented and cautioned that some of the websites may not be reliable, or they may not be monitored or guided by people that actually know the specifics of Duchenne. So be cautious about what you read on the internet. Check back in with your clinic team to see, does this make sense, and to get more information. If you, as an adult, are going on the internet and finding information that concerns you or that upsets you, talk with your children and ask if they are also going onto the website. Make sure that the information that they're gathering and thinking about is not upsetting to them or not taking them to an incorrect pathway. You can talk with your clinic team also about opportunities to connect in person. For example, the Every Single One tour through PPMD, or conferences that your neuromuscular team may be hosting, as well as fundraisers with many of the advocacy organizations, where it would give you an opportunity to meet face-to-face with other families going through the same experiences. I've kind of summarized what I think is the introduction to establishing a care team. And if you work with a Duchenne Certified Care Center, you would assume that then you're already getting a coordinated care team. If you want to learn more about the care team members or what care looks like for Duchenne muscular dystrophy, you can go onto the Parent Project Muscular Dystrophy website under the Care tab, which is arrowed there, and you'll see a drop-down box that says Assembling a Care Team. Underneath there is a Duchenne Care Guidelines link that will take you to a family-friendly version of the 2010 and updated 2018 care considerations for Duchenne muscular dystrophy. These are the guidelines for care across the lifespan. It includes them by topic matter as well as by age, and gives some helpful insights into what to expect as you go along the way. And I would encourage you to look at that for more details. You can also see there at the top of the page, there's the Duchenne registry button, so if you have not already entered the Duchenne registry, you're encouraged to do so. And with that, I think I'm turning it over to Claudia.
It's good. It worked. Hi, I'm Claudia Senesac. I'm from the University of Florida up in Gainesville. I'm a professor there, and I'm also practicing physical therapist treating boys with Duchenne and Becker muscular dystrophy. I want to welcome you to Florida, and it looks like you're going to have a nice hot day. So you've been hearing about physical therapy, and I wanted to give you an idea of what does physical therapy, what is it all about? What do physical therapists offer for you and for your son? So we're really trained to be movement experts. We have a background, a very strong science background in muscles, physiology, the nervous system, and function. We are good at problem solving, assessing and problem solving, where it has to do with movement. So we love people, so I just say we're people. We do a lot of talking, but we also do a lot of analysis and trying to figure out where is the problem and how can we solve it. PTs are specialists at adapting and modifying activities and environments. So you heard earlier, I don't know if I'm doing that or if it's on its own speed. Anyway, assessments. So you heard earlier about assessments, and we think that they're really important because it gives us information about your child. It gives us an idea of where your child is functioning in that particular moment in time. It also helps us to develop a plan of care for your child. In addition to that, it identifies critical time periods where there might be a change in your child's function. So it alerts us to that change and helps us help you to plan for that. So stretching has been a big part of what we have done for boys with Duchenne muscular dystrophy, and not so much that we're doing it, but we like for you to know how to do it. And we still think that this is an important thing to do. There is some research out there in healthy individuals that says stretching can provide a temporary change in range of motion in terms of improving range of motion. We think in the younger boys that this is really important. Frequently, the first muscle groups that get tight might be heel cords, it might be hamstrings, which are behind the knee, and so we like for you to know the right way to stretch those muscles. There are benefits to stretching beyond just range of motion. It's important for your boys to stay flexible and mobile so that they can be more functional. But in addition to that, stretching can improve circulation to the muscle. It takes the joint through its full range of motion, keeps the joint lubricated. So we think it's still a really important thing to do. What type of stretch is the right type of stretching program for your son? And that can vary. There are different types of stretching. There's passive stretching, where someone is just moving the arm and leg without much participation from your son. There's active assistive range of motion, where your son is actually participating in the stretching. Excuse me. There's active stretching, where there are some positions that your son can get into, or use of a piece of equipment, something simple like a wedge, which is pictured here in this slide, where maybe they stand on this to stretch out their heel cords, doing something that they do every day, as simple as brushing their teeth. So you put this maybe at the sink where they're going to brush their teeth. They stand on it. They're getting a stretch of their heel cords while they're doing that. They're participating and they're taking some control over their activities. Fitting stretching into your routine can be a daunting task. And we can help you figure out how to do that. And I'll be honest with you, some families are really busy. This might not be the only child that you have. You might have 5 kids, or maybe you have 3 kids. Maybe you only have 2 kids, but you're working full time. It can be a challenge to fit stretching in. We can help you do that. If you can't fit in this type of stretching that I've described, there are other alternatives, and we can help you find the best one for your son. Oops, now we're going the wrong way. I just want you to know this always happens to me. All right, night splints. You may have heard about night splints already. They're pictured here in this slide. It is a type of brace that is used at night. It gives you a prolonged stretch, and they're made primarily for stretching heel cords. It also helps to maintain that flexibility of the heel cord so that your son can get their heel down while they're walking. Who should wear these? When should you wear them? What if your son refuses to wear them? We have all kinds of little tricks and incentives to get your boys to wear them. We think that starting this early is a good idea because then the boys get used to it. They get used to wearing them, and it's not something out of the ordinary for them. But again, what if your son says, no, I'm not going to wear them. I don't care what you do. You can put them on me. As soon as you leave the room, I'm going to take them off. Or I'm going to wake you up in the middle of the night and have you come in and take them off. So all of these scenarios have happened, and we do have some ideas about how to make this a win-win for everyone and how to make it a positive experience. Exercise. Exercise is important. We know that if boys don't exercise, that their muscles atrophy. So it's really important to stay active. The big question is, how much exercise is enough and how much exercise is too much? So there are lots of exciting studies going on now, some at the University of Florida, looking at how much exercise is too much, what type of exercise is the right type of exercise for your boys, and also what does that exercise program look like? So I don't have all the answers on that, but I do know that there are many things out there that your boys can be doing on a regular basis. They may have to be modified. They might have to be adapted. Physical education class in school, you might need to go in and talk with the coach or talk with the PE teacher and make some modifications. The important thing here is to know what the precautions are. And the biggest thing is do not overdo it. So if you have one of those boys that is just go, go, go all the time, and you ask them to sit off and take a break, and they're like, I'm not going to do that. And so they're out running around on the field, and the next thing you see is they're just splayed out, sitting on the sidelines because now their muscles are sore, and they hurt, and they can't get up anymore. So it's really important for you to build into the routine that you do on a daily basis that taking a break is okay. And maybe you don't call it a break. Maybe you say, hey, it's snack time. So let's come over, get a snack, let's get some water, let's stay hydrated. You know, make it part of the routine early. So it's something that they don't feel self-conscious about, and it's also something that will preserve their muscles. Overdoing can result in breakdown of the muscles. And one of the signs of that is having dark urine and having blood in the urine. And that's not a good sign. That means that your muscles are breaking down. So I'm reinforcing and encouraging you to build in breaks during the day, during exercise. Equipment needs vary. What one family has for equipment for their son may not be specifically what you need for your son. So it's important to consult a physical therapist who's familiar with the equipment and familiar with boys with Duchenne muscular dystrophy. I mentioned that we are movement experts. That's part of our training. We understand movement and compensations. However, let me say that not every therapist has seen a boy with Duchenne muscular dystrophy. It's going to be important for you to, first of all, get a therapist that has pediatric experience, not an adult physical therapist. You need someone that deals with children on a regular basis. And you also want to ask that person, have they seen a boy with Duchenne muscular dystrophy? How much experience do they have with Duchenne? If they don't have experience with Duchenne, then you need to reach out to someone like myself or some other experts that are around the country that have experience treating boys with Duchenne. Because it is a rare disease, and because the United States is a large entity and there are many rural areas, it's very possible that when you go to the therapist, they may not have seen someone with Duchenne. Don't be afraid to take the reins and say, I'm going to connect you up, I'm going to find out who the person is that you need to call to help guide you in treating my son. Different pieces of equipment may be needed over time. And it could be something like a riding toy for a child that's very young, a bicycle that might be adapted for your son. It might be a wheelchair. It might be a standing frame. And these are things that occur over time. Your need for this will change over time. It was mentioned about insurance. Insurance can be frustrating, trying to get equipment. It can take a long time to get approval for equipment. Therapists in this realm can help write the letter of medical necessity, can help justify the piece of equipment, which is going to be needed for the therapist or for you to bill your insurance company. We always have to justify what we do with insurance companies, and therapists are trained to do that. So reach out and have them help you. If you don't have a therapist in your area, the clinic that you're going to can help guide you. PPMD can help guide you to a therapist that does have experience. Make sure when you're looking at equipment that not only is it right for your son, but that it's right for your family, for your situation. Because if someone recommends an expensive piece of equipment, and equipment is expensive, but it doesn't fit into your lifestyle, you don't have a place to store it, you don't have a place to use it, then it's not the right piece of equipment for you. And I can give you more information on that as we go through the weekend. Transitions. During transitional times, we can help. There are transitions where the care that your child may need will change. Environments change, where you're going from maybe preschool into elementary school to middle school, and middle school to high school, and high school into college or into the job market. We are there to help with those transitions and to help get the environment modified and adapted for your son. Positioning will be important, whether it's just positioning on the couch, in bed, maybe in the wheelchair, maybe in a regular classroom where your son's going to be sitting at a desk or at a table, We're out there and we are ready to help. Equipment we already talked about, and those needs will change over time during transitions, and exercise. By the way, swimming is a great exercise, and there's a lovely pool here, so get in the water with your son. So here are the takeaways. Physical therapists are experts in movement. Movement is a good thing. It's just trying to figure out what works for your son and modulating, monitoring the activity so you don't overdo. Stretching may help your son stay flexible. You want to know the right way to do it. So you want to get in touch with a therapist who can instruct you on how to do that the correct way. Night splints provide another way of stretching and are thought to be very effective because they're on for a longer period of time for a maintained stretch. Exercise, moderation, modification. Equipment, timelines vary of when you need equipment and what type of equipment you need. And physical therapy can help. So don't be afraid to reach out to us and ask questions. And first of all, and most important, make sure your therapist has some experience with Duchenne. And if they don't, you're going to help guide them to the right person because you're going to be experts. You're going to be your son's expert and most important advocate. I just also want to say that at the registration desk on Friday between 11 and 2:30, I'm going to be available on Interaction Alley to meet with you individually, talk about your own situation, maybe instruct you in stretching. So if you're interested in that, sign up at the registration desk. I will also be here on Sunday from, I believe it's 9 to 11, where we're just talking about more specifically what your child needs. Again, there'll be some instruction on stretching, and I'm happy to talk about anything that you want to talk about. I'll be here all weekend, so don't be afraid to come up to me. Thank you.
Hi, I'm Dr. Kent Williams. I'm a pediatric gastroenterologist from Nationwide Children's in Columbus, Ohio. I've been honored to be a part of this program for the past 5 or 6 years. And this year they asked me to do something a little bit different than previous. Some of you mostly will probably know me as more the poop doctor. That I show lots of images of poop, talk about poop, love poop. I'm not talking about poop. But I will mention it. I can't go a whole talk without talking about it a little bit. And I did love the title they gave me, Simple Nutrition Advice. I don't know if that's a comment about me, but it's very true. I am very simple in very certain things. And what we're going to go over today it fits in really well with the previous talks of trying to build your team of what you need and to help get a member for working with nutrition, just not for only your young man with Duchenne's, but the whole family. Okay. Because there are nutrition risks in this population, significant, and they start very early. When you first get diagnosed, and if you're put on steroids, the steroids are going to affect your appetite, they're going to affect your retaining salt, they're going to increase your weight, they'll maybe even decrease your growth, and it can affect your bones. The other thing that's not so well known, I feel like, and I didn't know this when I first agreed to be part of our multidisciplinary team at Nationwide, is how much behavior is playing a role in the young men with Duchenne's, that there's a increased incidence of psychosocial issues. And I am coming from a specialty of actually working with autistic children, and I didn't realize how much autism and autistic-like behaviors were very common in those with Duchenne's, and which can have a big impact on eating and picky eating. And then vitamin D deficiency is very prevalent in our society, mostly because we're spending most of our time in rooms like this with no sunshine. And so, again, becomes very important when you start talking about bone metabolism. And of course, then that affects, vitamin D affects your calcium. And depending on your picky eating and how you eat, whether you're actually meeting your calcium requirements. And then as the young men continued to grow and with age, the challenges come different. As you are maybe losing function, not as ambulating as much, you're not spending as much energy. And if you're still on steroids and you're still eating the same, you're going to gain weight. And then eventually there might be things that will start affecting your oral intake and how you're eating, which we'll go over a little bit. And then things start to switch. And we start worrying about keeping the calories coming in and keeping the weight on. There's issues with swallowing, whether you could have problems with coordinating your swallow muscles or even just chewing, that it's a slow, gradual thing. The young men will start to alter how they eat and what they eat based upon their ability to swallow and their ability to chew. And then there are studies showing that there is impaired gastric function over time. There's muscles in the stomach that they are most likely affected, not equally among everybody. It probably has some to do with the different genetics that are involved in each kid, but that there is a delay in gastric emptying, which then is going to affect your appetite and possibly make it more of an issue of reflux and feeling bloated and not feeling as comfortable. Here is the person you need on your team. A registered dietitian nutritionist. You don't need a guy like me. You need a registered dietitian nutritionist. In fact, are there any registered dietitians here right now? Can you raise your hands if you are? Find one. At your moment, they're very important. These people are unsung heroes. They are like the elementary school teachers of our clinics. These people are doing this not for the money. They're doing it because they love doing it. I have never really ever met a registered dietitian nutritionist that I have just not really enjoyed being with and working with. They work so hard for you. If you have any questions, they'll look it up. But they're the ones that are going to do the best job of measuring things, of monitoring the weight and height. They're going to be the ones monitoring what you're taking in, how much calories. And they're the best ones of trying to figure out, does your kid need to be on some kind of supplement, or not just supplement of calories, but minerals and vitamins. These are the people that are extremely important when you're first starting out of like, okay, we're going to gain a little bit too much weight. What do we need to, what is actually how much we're supposed to be eating in a day and things like that. And then as things begin to progress, how much are we supposed to actually be putting in, and what are our goals to actually to try to achieve? These are the people that help you the most. Because, most of the, like our clinic, most of the focus is on neurology, cardiology, pulmonology, physical therapy, and GI even. But what's really important is nutrition impacts each area. If you start to be overweight, you're going to put more strain on the heart. If you're not eating enough, you actually start to lose more muscle, and that will affect your heart, your breathing, and the same with your ability to muscle breakdown and stretching. There was a work group put together that actually had various experts that came out with recommendations for GI nutrition for every 6 months and 12 months. The 6-month evaluations, top of the list was to meet with your registered dietitian. Screen for swallowing and dysphagia. It can be very subtle. Again, need to know more about just not whether you're choking and gagging, but have you started to notice that you tire out as you're chewing? Are you avoiding foods that require you to chew? Or have you had problems with liquids? Those types of things to try to figure out if there's starting to be problems with the swallowing, coordination. Screening for reflux, heartburn, materials begin to reflux back up into the mouth for gastroparesis and problems, again, also with muscle breakdown, possibly in the GI tract. And then, my favorite, constipation and poop. Believe it or not, the first and the most common sign of constipation is an effect on appetite. If you're constipated, you actually you get the sensation of being full quicker, and you can have belly pains. And one of the first signs across most studies that I've ever read, and one of the first signs is early satiety and a decrease in the appetite for constipation. So actually controlling your constipation can actually help with your appetite and with nutrition. In fact, it's not uncommon that if we diagnose someone with constipation, we start to treat them, they don't immediately get about a 5 to 7 pound bounce. over time because they're able to eat better. Then at the yearly evaluations, you look at vitamin D levels, actually do blood tests, look at your vitamin D levels where you need to be on supplementations, and making sure you're assessing how much calorie you're getting in to make sure you're able to keep up with your bone growth, and particularly if you're on steroids, any issues with the bone metabolism. So parents are always asking me, well, what supplements should my child be on? Well, the only ones that we really have guidelines for is the vitamin D and the calcium. Outside of that, multivitamins, mineral supplements, there's no real known data other than most people agree that when you work with your registered dietitian, if they feel like you are very limited, if you're a very picky eater or you're getting decreased, that they are able to recommend multivitamins or supplements to make sure you're getting the daily requirements for all your minerals and vitamins. However, there is no current evidence for or against multivitamins or herbal supplementations or any kind of nutritional supplements at this point. It doesn't mean that you shouldn't do it. It doesn't mean you should do it. There's just no evidence out there right now telling us whether this is worth it or not worth it. Special diets then. So what do I feed my kid? There again, it's good for a guy like me to be in a field where there's not really much evidence, because then I look like a star and I know what I'm talking about when no one else does. So that's very true when it comes to nutrition and Duchenne's. There is very little evidence-based research. There is some evidence out there maybe of doing certain amino acids and certain supplements, but other studies showing there's no difference at all. And they've also looked at this in animal studies and animal models of Duchenne's. Basically, this is my second big point after getting a research dietitian on your team: include the whole family. Include the whole family in the dietary and nutritional plan for your child. Think about this. Nutrition and diet definitely plays a role, not only in your health, but also in your emotional well-being. And you're already in a situation where you're going to be extremely stressed, you're going to be extremely tired and pushed to limits. Nutrition can help with that day-to-day, and that helps everyone in the family. The other thing is you got the moms and the sisters could be carriers. Whatever is going to help the son with a good, healthy diet can help them too for long term. As for individual plans for each patient, again, work with your dietitian. Be very proactive about doing dietary diaries and what's going and what you're able to actually get your child to eat or not eat. Red flags to look out for, to start thinking about as things begin to progress, you start to lose function. Choking and aspiration, of course, is right off the bat. But again, I said don't wait until you're actually choking, but are you starting to see changes in what food selection is? You're doing softer foods. We're avoiding meats. We're avoiding things because it's so hard to chew. Or avoiding liquids because it's so hard to swallow and you are having some choking. Again, the problem's chewing, not only just avoiding it, but is it taking a long time? Are you having to be able to feed yourself? Or is the child or your young man dependent upon someone else to start to help him feed? And taking longer and longer to have the meals. And then all those things eventually start to end up affecting the weight and weight loss. And this is really tricky to figure out because you're losing muscle mass, so you're going to lose some weight. But is it due to that, or is it due to the dietitian? Again, working with your registered dietitians to really try to figure out if you're getting enough in, and could this be from caloric? Because once you start getting to malnutrition, things then are going to start speeding up. You're going to have more muscle loss. You're going to have reduced activity and ability to be able to ambulate in those things. So my suggestion, if you start to see any of these red flags, and this is going to be, it's always a tough subject to broach with any family, but you really need to start thinking about a G2. It's not a loss. It's not a failure. This is actually should be looked upon as something the same as you would look upon using a wheelchair or any other instrument, be able to help you maintain a good quality of life. The benefits, again, there's no great studies showing that improves quality of life, but I can just tell you from my own experience through the years, not only with Duchenne's, but with all different types of chronic illnesses, it improves daily function. The children are able to focus more, and this is incredibly important if you're at that stage you want to go to college and you want to be more independent. If you're having problems feeding yourself, you're taking long times to have meals, you're going to start skimping on things. But by using a G-tube, and again, using a G-tube is not taking away your ability to eat. It is only as a tool, as a supplement. Never do I want to take away someone's ability to eat and actually interact. That's a very social time, not only with the family, but with new friends, being able to go out to parties, being able to do things. It's very important. Never would I say we're taken away, unless, of course, there's a risk of aspiration and those things. But this is to help maintain and to keep you at a certain quality of life. Improves the endurance and energy levels. And the other thing that's very ironic is that a lot of times if a kid is having a lot of psychosocial issues, and this is in rare instances, and you're struggling giving medications, and you're struggling keeping them hydrated, or they're getting sick, this becomes a very good way of actually being able to work through those really rough times. And it gives you access for nutrition and fluids at the same time, and access for being able to give the medications. So in summary, meet regularly with a registered dietitian. And I should have expressed this earlier, but a registered dietitian, not a nutritionist, not someone you just find in the yellow pages or on the thing, or someone who's like got a shingle out saying they're a nutritionist and, oh, by the way, we have all these supplements that you can buy. No, a registered dietitian who's undergoes training and who's part of the team of your medical team. Closely follow the weights and caloric intake. Look for those red flags, and do not put off considering the G-tube. Think about this, though, too, because if you're already starting to see those red flags, it will be much easier to get a G-tube and maintain a quality of life early on instead of keep putting it off, and then you get more malnourished, and then the risk of the procedure, the risk of things progressing quickly start to go up drastically once you start getting malnourished. So think about it earlier versus later. Thank you.
So questions. So we're going to take about 20 minutes for questions and a break or whatever until we begin the next session, which is on behaviors at school. So if you have questions, just please come up to the mics and ask whatever questions you want about the care or stretching or the care team. Please feel free to ask your questions. Now's the time.
Good morning. I had a question in regards to physical therapy. Do you think that weekly formal physical therapy is necessary? Sorry, did everyone hear me? Weekly formal physical therapy.
We have these mics on?
Hello?
Now
Okay. So your question is weekly physical therapy necessary? I think it really depends on your child. There are some kids that I'm following that I see maybe every... Oh, here we go. So it could be every 6 months. It could be, I do have some I see once a week. I have others I maybe check once a month. So it just really depends on your child and what the needs are.
When do you think they would need to be seen weekly?
Most of the boys that I'm seeing weekly are either going through a transitional period, and so I'm seeing them weekly for a short period of time to help them through that transition. Or maybe they're really tight early on, and so we're working to try and see if we can maybe get a little bit of range by maybe doing something like serial casting. I would say that would be the exception.
I would like to add that if your child has an injury, for example, a broken bone, if they've had a fractured leg, sometimes there's a need for an intensive kind of rehabilitation, and that can be critical to maintaining ambulation, to work with the physical therapist to rehabilitate during that time. So there may be episodes of care that are necessary to have more intense physical therapy, and then other times it might be a plan of physical therapy and stretching that you do at home or with a school therapist sometimes too.
That was a really good point, because we're now seeing that boys that have fracture, there's a good opportunity for us to maybe get them back up on their feet.
Yeah, I think they're trying to work out the echo issues, so we apologize for that. So maybe one of the questions, just to clarify, is in stretching, I mean, I think that I've heard from parents around the U.S. and outside who go to various clinics, and sometimes they're encouraged to do physical therapy stretching on their children, for instance, the Achilles, hamstrings, and IT bands, 3 times a day, 2 times a day for a period of 45 minutes or so, right? And then at other clinics, less is encouraged, or the need for several times a week versus every day. And I think the real question is, how much is necessary? It probably depends on what your evaluation looks like. Because as a parent, you get, if someone says you have to stretch 3 times a day for 45 minutes, every single possibility in terms of ligaments, it's kind of this guilt that washes over you when you skip 2 days, and then if he falls, you think, oh my gosh, it's because I didn't stretch him for the last 2 days, right? So how do you balance that out?
That's a really good question, and I think it's important for everyone to realize that right now there isn't evidence either way that says if you stretch 3 times a day for 45 minutes, it will prevent your son from getting muscle tightness. On the other side, there just isn't a lot of evidence on stretching. We do think there are other reasons to stretch, but we think that doing a stretch for 30 seconds sort of measures up with what the research is in terms of what could be effective for keeping your son flexible. It doesn't have to be done 3 times a day. If you can fit it in once a day, that's great. If you can't fit it in at all, that's fine too. We'll find other ways to help your son stay flexible. So I think it's really important for you to understand that stretching is more effective in younger boys than it is in older boys. There are still reasons to keep moving the joint for the health of the joint and for increasing blood circulation, but certainly not overdoing it. 45 minutes a day, that's a large chunk of time. And it's hard for someone that's healthy to fit that in. So I think that's my personal opinion. I think that's unreasonable and not necessary with what we know about stretching and what stretching can achieve.
Thank you. Question?
Yes, you showed us a map of all the PPMD approved sites to take your child for their yearly or 6-month checkups. We have found that definitely from our experience, those that were approved by your organization seemed like it was night and day. But where we live, the closest one is 9 hours away. Just on the map, it shows the southeast is just kind of a blank sea. And we were just curious if that might be changing in the future or what you see in the future for others being put online. Thank you.
Yeah, so thank you for the question. I think that it is true that you go to a certified center and it's night and day compared to some of the rural clinics. So first of all, even in order to begin the program, we gathered, this has been more than 5 or 6 years ago, the CEOs of hospitals to ask them what would make them willing to invest in an interdisciplinary clinic specifically for Duchenne, because it is an investment and it's a commitment on the part of that team. Not only it's a commitment on the part of the hospital or the academic center, and then it's having the team members present to be able to work in that interdisciplinary care. And as we know in this world today, you can get care varies across this country and certainly across the world. So once we gathered data about what the investment would be on the part of the CEO and the center, and what people they had to form this interdisciplinary team, and of course it was based on the care considerations or standards of care that were published, then the process that has been established is there is a steering committee and an advisory committee over this. So the steering committee includes all of these committees. Steering committee and advisory committee includes physicians, multidisciplinary physicians, parents and families, and in some cases industry. One of the members of pharma is there on one of those committees. So then a center makes an application to the steering committee and says, we meet these criteria, because we have an application online and we meet the criteria. The steering committee then reviews that criteria and says whether or not they've met that criteria by that submission. It goes back and forth a lot because there's questions and answers. Then following the steering committee who says, yes, this center seems to meet our criteria, they go out and do a site visit. So they go to the site, they interview every member of the team, they follow a patient through the team to say, your team says they're doing this, so we're following these patients along. So the PPMD team goes out there, and usually Kathy Kinnett and a physician or a nurse practitioner, and they go out and follow the patients to make sure that you're getting what they're saying you're getting. And then we do a chart review to make sure that what they're saying they do and what they're giving is also recorded in the chart. So it's a pretty thorough process. Ideally, fingers crossed, we would love to have a certified center in every state. That would be ultimately our goal. I can say we were just in Arkansas, and so we are getting submissions from some of the areas that aren't come right to mind. You think of Nationwide and Cincinnati and UMass, and you think of Iowa, and you think of UCLA, and so there's these that come to mind, and most of those people are here. So we are really working hard on that. We'd love it in every state. We are trying to get there, but again, you have to have the team to be able to do the submission so that you become a center. And I know that it's frustrating driving nine hours or more, but I also think this. Christina said going there once a year is important. And then maintaining that relationship with your primary care doc or with the center that's nearby, because that encourages the nearby, we'll call it a hub and spoke, right? That spoke center to kind of be able to invest in their team and understand what it looks like. So we're trying to do all sorts of different things to encourage these teams to develop over time by educating them, by bringing them to meetings like this. We have a healthcare summit that is only for healthcare professionals so that we're really engaging them. And we now have applications from about 4 more sites that will be reviewed. We have international applications. They were just in the Czech Republic. We've got some from Mexico and Brazil and other places. So collectively, and why would we do this, right? First of all, because you deserve to have the people you love have optimal care. But second of all, it's about data collection, right? Because the more data we have, the more we understand this disease and we understand progression, and we can maybe try to track down why 2 people with the same mutation are progressing differently and look at those biomarkers or those genetic modifiers so that we can better predict what's happening. And obviously we want more sites because we want and need more clinical trial sites so that more people are able to participate. So what you could do is encourage your site to talk to us. And you could talk to us about sending some of those folks to the summit, which happens in January, and it'll be out at San Diego this year, I had to remember. And then they get with their colleagues, and that builds collaboration. And the purpose of that summit is really, instead of having these centers siloed, it's to create this very large collaboration across the medical environment to improve care. And I go on for ages about preventing the first fracture is really important instead of the care considerations, say, treat with bone-sparing drugs after the first fracture, right? These behavior issues are paramount. The pooping issues are really something we better understand. The stretching, to get more evidence. So there's lots of reasons to do that. So go home, talk to them, tell them to reach out to Kathy Kinnett. We have wonderful people on that steering committee, and they'll take a look and really help them build, because it should be in every state. I mean, I was amazed that when my boys were diagnosed, I thought, I'll go to New York because that's where something is. There is no center in New York. We have an application, but no center in New York, right? So if there's no center in New York at the time, there was a clinic in Cincinnati, Ohio, and it was not very good. And then Brenda Wong was recruited to Cincinnati, which started to build that clinic. So it is baby steps, and it's frustrating, but I would go to the center 9 hours away once a year, and then I'd make sure that communication was pretty good with my primary care and the center in my state. Other comments?
I would say that families have more power than you think. You can certainly talk with your home neuromuscular community and encourage them to look into what would it take to bring those professionals together so that you have a coordinated clinic closer to home. Some of the newer centers have been kind of grassroots family-based, where the families said, this is the care that we need. They approached their children's hospitals and they talked with them about what their needs were, and they were more likely to listen when it was the consumer asking for this care. And then they can help bring those providers together.
So that exactly happened in New York. We have a submission from a hospital in New York that is called Stony Brook, and that's under review, but this is how centers get developed. And those families went there and said something should happen in New York, and they've been working for the last 5 years to make it happen. So again, I think this is a process, and we'll soon announce a first adult center. So again, how do you care for these young men as adults when they age out of their academic center? So all of that is on our mind. Okay, question.
Yes, I wanted to ask a question for Dr. Williams. I'm curious how you feel about the omega-3 study which occurred in Mexico City and the Synergy COQ10 study that happened a decade or so ago. Are these supplements our kids should be taking, and should we be furthering these studies that have shown progress?
Yeah, that was kind of some of the studies I was referring to, that there's been some studies showing that there is benefit from some supplements, particularly those that you're talking about, and there was others for arginine and some amino acids. They do need to be furthered more. I feel like for sure nutrition, just basic nutrition, basic composition, the supplements. I mean, there could even be, one could hypothesize that even using some of the anti-inflammatories, which kind of omega-3 is more along the line, but there's a whole host of others, curcumin and other things have been used in, say, inflammatory bowel disease. Much more needs to be done to really do it. I just can't say those for sure do what they found in those studies, because they were just kind of more of just isolated studies, smaller numbers, and so there's not the evidence behind it saying for sure that they would work. And then the other thing would be, do they work for everybody? Just the same way that steroids doesn't work for everybody, are there certain people that would more benefit from certain supplements than others? But yes, much more needs to be done.
Yeah, and so I can respond to the data in our registry. So the Duchenne registry is a registry we started in 2007. So we've just published the 10-year report on the registry, and more analysis is being done. There are 5,000 people in the registry. Two-thirds of those are from the U.S. and 1/3 is from abroad. And we looked and specifically analyzed people on supplements. And this was and obviously we didn't have a prescribed list of supplements because there's no evidence to prescribe that list. So some of them were on the omegas, some of them were on other antioxidants like Protandim, some of them are on curcumin, so the list goes on and on. And what we found is in the data, those children that are on supplements do a little bit, not miles, but a little bit better. So their ambulation is a little longer, their use of non-invasive ventilation a little push back. But what we can't account for in the data is when you're on taking supplements, if you're in a family that you have a regimen of supplements, you're probably also doing a regimen of stretching. You're probably also have a very good attitude about what's happening. There's probably a lot of hope in that family. There may be more resources in the family. So we call all of those things the soft part. We can say that the supplements did improve the quality or the functional outcomes of those children to some degree, not, as I say, not gigantic, not by years. We could say, and Stan Nelson, if he did the analysis, about 6 months difference in terms of function, but we also could not account for all of the other things that might influence the outcomes of those children. So we as an organization have thought about doing trials in steroids, not steroids, trials in supplements, but what's the supplement? What we struggled with Eric Kaufman's Synergy group, with Lee Sweeney's group at the University of Florida, Gainesville, with the folks in Australia that I can't remember their name who are using supplements, Miranda Groundsand group who are thinking of supplements, and there was a group out of the UK that is looking at supplements, is how will we know what's the core set of supplements? How will we make sure that those who are in the trial or accessing the supplements, if it's a patient report, if it's a sort of an open label trial that families do, how will we make sure that the supplements you're getting in the US are the same as Mexico or the same as the UK, same consistency? And when we evaluated the supplements, we couldn't get the same level of supplement in each dose. So we found that it's an area that requires and should be fully investigated, but the how part really escaped the team of people we brought together to do it. And now with 29 active clinical trials, we find that we're in this very difficult spot of saying, yes, supplements may help. if you can afford them and they don't destroy your budget, it might be worth trying. But at the end of the day, we're not ever likely going to be able to come and say, the supplement regimen is X, because of each individual differences. As Ken said, some kids respond to steroids, some kids don't, some kids respond to cardiac drugs, some kids don't. So we need to really understand, this is one of the issues that we're really trying to drive home, is trying to get a protein signature here so we can really look at the proteins and see what's happening. And I think if we can get down to that level, and we're working toward that, we have some analysis going on the proteins going forward, so we'll be able to speak to that in a couple months about that analysis. So if we could get a protein signature on each child, then we gave them X supplements, then we could see if the proteins normalize. That might be a better insight, which would be terrific.
Pat, could I follow up with a question about fiber? I've noticed for my son that indigestion was an issue. And at one point we tried giving him broccoli sprouts as a supplement. And when he started those, the indigestion issues went away. We stopped the sprouts and indigestion issues came back. We put him on a fiber supplement, Metamucil, on a daily basis, and digestion greatly improved. Now my son's approaching 10, he's young. But I'm curious, in your experience, how important is fiber?
It varies from person to person. Fiber has, people, like when we start talking about treating constipation, everybody starts thinking about like what your fiber intake is and things like that. And when you say indigestion, that's a very broad range of it depends what the specific symptoms are. You look at studies that use fiber for, say, irritable bowel syndrome, where you have bloating, abdominal pain, discomfort, alternating stools. Some studies have shown that there's been great increase or great help with using fibers. Other studies actually show that maybe it actually increases the symptoms. So it's different for, I think, again, for each child, and it has to be taken in sort of looking at assessing the whole situation of what the rest of the diet is like, what are the actual symptoms. Fiber for sure, though, I mean, if a kid is having abdominal pains and issues with having bowel movements and things, I mean, I've had kids respond to fiber gummies, so fiber, or not only Metamucil, but Benefiber is one that we use quite a bit too, and things. So it's definitely, I think, one of the things where it's like very low risk, but very high yield if you're having GI issues and complaints.
Okay, thank you.